The question is, what are the benefits of getting a COVID-19 vaccination? There's a lot of benefits. Firstly, you are able to generate antibodies and prevent from getting an infection. So by all means, if you have an opportunity, please take the vaccine. Will this vaccine protect the variants? So far we know it does, but not at the same level of efficacy. So the first two vaccines, the Pfizer and the Moderna, when they were tested throughout the world, the variants were not a problem at that time. But recently the B.1.1.7 UK variant surfaced, and there were some studies in England showing that their AstraZeneca vaccine had some diminished capacity. The third vaccine that was just approved recently, the Johnson & Johnson, that vaccine was tested in South Africa, South America, United States. And looking at the South African strain, it looks like it was not as efficacious. So yes, it's still efficacious, still worth getting. How fast does the vaccine take effect and provide protection? Generally, based on the Pfizer and the Moderna studies published, 50% of the time you will get your antibodies elevated within 2 weeks. Most vaccines, 2 to 3 weeks is what's needed for your body to generate antibodies. For the first two vaccines, you need a booster, a second shot. One 21 days later and the other one's 28 days later. But the third vaccine, the Johnson & Johnson vaccine, you only need one shot. So the question is, do you have to be precisely on the 21st day or the 28th day? The answer is no. As long as you are within 4 days of before or after, that would be okay. But if you had a lot of lag, I would still get the second shot, because the second shot is what really elevates the antibodies and really boosts your immune system. So what would I tell people who are nervous or reluctant to get the vaccine? It's understandable to be nervous and reluctant to get the vaccine. It is a very new technology, never been tested, never been used before. But so far, from what we've seen, all the millions of doses that's been given out, the side effects are rare. Severe, moderate side effects are rare. And most people just have pain at the site of injection, and then during the second shot, most people have a little bit more side effects of flu-like illness, fatigue, headache, but for the most part it is moderately safe. Since the virus is mutating, will we need another vaccine? Absolutely. If it shows that the efficacy of the vaccine has diminished to the point where it's not working well, version 2.0 should be out to counter the variants. The virus evolves every 2 weeks, and not every change in the virus makes it beneficial. But if it does, then it basically becomes the new natural wild type. And so then we have to adjust our vaccines to cover for the new wild type.